start with our next presenter. We'll go to our next presenter is Bobbi Perkins. And Bobbi had two site mentors. Her first site mentor is Holly Jorn, who's with the Montana Public Health Institute. And her second site mentor is Robert Childs, who's with JBS International. And Bobbi did her practicum with the Lewis and Clark County and with support from the Montana Public Health Institute. And the name of her presentation is Expanding Naloxone Distribution and Fentanyl Test Strips for High-Risk Populations. So take it away, Bobbi.
Great. Thanks, Lee. Good afternoon, everyone, and thank you for the opportunity to share the highlights of my applied practice experience. My name is Bobbi Perkins, and my project is to expand naloxone and fentanyl test strip distribution in Montana rural communities. So over the next 10 minutes, I plan to introduce you to my amazing site mentors, provide an overview of the project, discuss the products that were developed, highlight the competencies I selected to focus on, and then discuss the overall lessons learned and takeaways from this experience. So I'm honored to introduce you to both of my site mentors who graciously gave their time on this project. My first site mentor is Holly Jorn, who's a public health program officer with the Montana Public Health Institute. Holly has a passion for public health and prevention work and has been working collaboratively for nearly 2 decades to create systems change that will improve health outcomes for all. Holly is definitely focused on health equity and ensuring that all individuals are represented in the work that she oversees. She's a registered nurse and acquired her master's of public health from the University of Montana. My second site mentor is Robert Childs, who I'm privileged to work with on a HRSA Rural Communities Opioid Response Program. Robert is nationally known subject matter expert on harm reduction for opioid prevention and HIV work, and has extensive experience working at a state, national, and international level to advance public health legislation and advocacy. He has served as the executive director for the North Carolina Harm Reduction Coalition and as the public health operations manager at the Positive Health Project in New York City, where he oversaw lots of public health work, including law enforcement relations training on harm reduction, and working with individuals injecting drugs in the public domain. So both Holly and Robert are on the call, and again, I'd like to thank them for their support on this project. So why is expanding access to naloxone and fentanyl test strips in Montana important? Sadly, since 1999, across the US, over 1 million people, it's really hard to wrap your head around that, have died from a drug overdose. And the number of overdose fatalities are continuing to trend upwards across the nation. In 2021, there were nearly 107,000 people who died in the US. We had 199 people die in Montana. Strikingly, the rate of overdose has increased each year, and by 14% from 2020 to 2021. While Montana overdose rate is lower than the US overdose rate, we are seeing a similar trend of increasing overdoses each year. Also important to note that 3/4 of all overdoses opioids, such as fentanyl. We're also seeing an increase in the number of stimulant-related overdoses, primarily for methamphetamine and cocaine. This data is striking, but what's most compelling is the disproportionate increases in overdoses amongst people who are Black, Hispanic, Latino, and American Indian and Alaska Native, as compared to non-Hispanic white population. The Black, Hispanic, Latino, and American Indian, Alaska Native populations also experience other social determinants of health challenges with accessing healthcare services, health insurance, housing support. So preventing opioid fatality among these populations is a priority. There is good news. We've seen significant response to the US opioid epidemic at a national and state and local level. Many communities are distributing Narcan, which is a well-known brand of an FDA-approved medication called Naloxone, which is used to reverse an opioid overdose. However, there continues to be a need to prioritize what we call low barrier access to naloxone by ensuring that people have access 24/7 of naloxone in the community. And as a second prevention effort, access to fentanyl test strips can save lives and prevent overdoses. Prior to May of 2023, drug tests were considered drug paraphernalia in Montana and were illegal to obtain or distribute. And they're effective for preventing overdoses by testing drugs before people consume them. Thanks to the Montana legislature, accessing drug tests are now considered legal, but there's still significant amount of stigma around fentanyl test strips and even providing naloxone directly to individuals who use drugs. Therefore, continued training on these life-saving interventions is needed, particularly for expanding access to those who experience racial and socioeconomic to community-based partners on how to support harm reduction strategies and promote low barrier access to naloxone and drug test strips. So there's 5 products that I worked with my mentors to develop. And the first one was information on structural bias and the role of stigma that prevents people from accessing healthcare and substance use treatment. The National Coalition for Harm Reduction, along with SAMHSA, the Substance Abuse and Mental Health Services Administration, provided a lot of material used for this fact sheet. The second product provides a summary of US and Montana data on opioid overdose rates. The CDC has dashboards designated to overdose data through 2021 and were used to create this document. And I know these are really small and hard to see, but you'll certainly have access to them if you're interested. You can see the full document. The third product is a how-to guide designated for public health and community-based programs that includes the previous 2 documents and also includes additional information on Montana laws, such as the Good Samaritan Law, the Naloxone Access and Standing Order. There's the new updated law that I mentioned regarding drug test strips, as well as specific strategies for implementing a low barrier naloxone and fentanyl test strip program. Currently, there's no document quite like this that exists that focuses on establishing low barrier access to opioid prevention. And this guide was designed from an example created by North Carolina. A fourth product is a fact sheet designed specifically for public health and community-based programs that promote the importance of low barrier naloxone, also called Narcan, as an effective overdose prevention strategy. And the final product is a survey tool designed for learning how community-based programs in Helena are supporting access to naloxone, as well as identifying and addressing stigma associated with drug use. This survey hasn't been implemented at this time, but this tool will be used for gathering information from selected community-based organizations who serve clients who are at risk for experiencing an overdose. By implementing this tool, we'll learn more about the availability and support for low barrier access to naloxone among these organizations. So I won't spend much time on this slide, but wanted to share the 3 foundational and 2 concentration specific competencies that I focused on throughout this project that were the emphasis of the products that were developed. And additionally, this is just a really high level overview of my timeline that I worked with to do these activities. And a more detailed copy of my timeline is included in the portfolio. So overall, through this project, there were a couple of valuable lessons learned. Overall, Helena is proactively supporting effective life-saving strategies through naloxone access and drug testing, primarily with the work that the Montana Public Health Institute is doing through their hub model. From my preliminary conversations with public health, there's a need for continued conversations around stigma towards illicit drug use, as negative views are pervasive. We need to continue to work on training community partners to understand why people use drugs, and to view substance misuse and abuse or addiction as a complex chronic disease that affects how the brain functions and is often complicated by past and current trauma, the environment, and a person's behaviors. Engaging with people is another takeaway. Engaging people who use drugs to design overdose prevention outreach is essential. Reaching into the community and involving people who use drugs is really valuable and helps identify the needs of the people who are at greatest at risk, who are at greatest risk. It's that mantra that we hear, nothing about us without us, which can ultimately increase the potential for saving more lives. People with lived experience can successfully transform. This is another big takeaway. Peer support specialists have an ability to connect with social service programs and help them embrace harm reduction activities. From my preliminary conversations with some stakeholders, I learned that one federally qualified health center has a peer support specialist who's very open about his lived experience with a substance use disorder. He is working very closely in the community to educate community-based programs that serve vulnerable populations. And through his outreach, he was able to connect with a community-based organization in Helena who has a history of resisting harm reduction across the country. And that community-based organization is now installed a Naloxone vending machine and is preparing to distribute fentanyl test strips. This speaks to the power of peers who can overcome barriers and institutional stigma. And lastly, prioritizing individuals at highest risk for an overdose by targeting intervention towards individuals who experience health inequities and who are disadvantaged socioeconomically is critical. This includes people of color, members of the LGBTQ+ community, individuals returning to the community from prisons, jails, or even detox programs are important to really prioritize by getting these life-saving measures into their hands directly instead of through EMS, law enforcement, which is another great effort, but getting it into the hands of the people who might be using drugs is really important. So that is my presentation. Thank you for giving me time to share. I look forward to answering any questions you may have.
That's great, Bobbi. Thanks so much.